Joining us to continue the conversation are Carolyn Scanlon, CEO of the Hospital and Health System Association of Pennsylvania, Dr. Gwendolyn Poles, internal medicine at Pinnacle Health, and Gary Wevadau, president of Wevadau Insurance and Benefit Strategies and a member of the National Association of Insurance and Financial Advisors. Thanks to all of you. We really appreciate you coming in. Universal health care has to come to America. We can't sustain the cost of the current system we're on. What does that mean, though, for insurers? And what do you, when you look at his plan, what do you see?
Well, there has to be some sort of reform that comes down the pike. There's less people insured now today than ever, and Carol and I were sharing earlier, and that just drives up the cost of care.
Why is that happening? Why is that happening more today than in the past?
People can't afford it. We get calls every week from proposed people shopping for insurance, and a lot of them don't understand the cost. They're covered at work, their employer's paying a large sum of it, and then they get the reality check, and it's a shock to find out that it's going to cost, on average in this area, about $400 for a single individual and about $1,000 a month per family.
And explain to us, why does insurance cost that much? You're basically a healthy person.
Right.
You know, we're a family. We pay $800 a month for health insurance. Why?
Right.
Why is it that much?
Well, cost of care. I mean, this is the greatest country on the planet as far as technology and advances and the treatment that we receive. It doesn't come at a low cost. But another side of it is, too, the reimbursements are very low on the public health sector from Medicare and Medicaid, which drives up the cost for those who do have the ability to pay, which are the insured.
You're not here representing Independence Blue Cross or any of the Blue Shield companies or that, but at the same time, people read in the paper that they have huge surpluses that they're sitting upon, and they say, yet you're going to increase our rates double digits for many of the last 10, 15 years. So people have concerns about that. Why is that happening? Why do insurance companies have these huge surpluses?
Well, they need those surpluses to go into the future. A lot of it has to do with controlling costs and spreading the risk over time, and to cover the catastrophic events that do happen from time to time. But I think a lot of people's care, the majority of the money is spent in the last 6 months of their life.
That's true.
So throughout their living years, you're correct, you're spending all this money, $10,000 to $15,000 a year for your family, and you may not even need that amount of care, but you need it. It's kind of your access to get the care and get the treatment that you need.
Let's go back to Obama's plan specifically. This is, you have there writing your notes, a pay or play for employers. A lot of small businesses. If you were to have Kevin Shivers from the National, what do you like about it? What do you think he's going to really have trouble with?
Well, that's a great question that we could spend hours on, not a minute. So I'll have to defer.
We'll be doing more on health care. I know we will.
But I think there has to be some mandates that come down. I like the fact that he's going to offer incentives to small business, which is who we serve, tax incentives and things like that. But health care is one of those tough issues where people have become very expectant of it. There's no other insurance on the market today that people expect to do what they expect out of health care. You know, your auto insurance is if you crash your car.
All right. Well, I am going to have you back because we have to move on now.
All right.
But thank you so much for joining us.
Thank you. Thank you.
For a continued discussion.